You know, they say that one death is a tragedy, but 1,000 deaths is a statistic. You want to realize that each number is a human soul. We had more pain clinics in Florida than McDonald's in Florida. When you're told to come down to South Florida to Heavenly Valley Recovery, forget about the fact there are no valleys and where you're going ain't heavenly. When you get here, you're then brokered into an unending system of endless relapses, only to leave in an ambulance in a body bag. It's patient brokering, it's illegal kickbacks, it's insurance fraud, because you want your healthcare decisions to be made by what is best for you to get you healthy, not to get someone else rich. See, a lot of this is fueled by abuses within the Affordable Care Act. Now, the Affordable Care Act has helped so many people get access to behavioral health care that otherwise wouldn't. But because there's a new set of benefits within the Affordable Care Act, you have wrongdoers who are exploiting that. There are no lifetime limits anymore for your mental health coverage if you're going through rehab. There is no yearly limit. Addiction is a pre-existing condition. And so there's an incentive for the bad providers to keep you in an endless cycle of relapse instead of recovery, because that's where the big money is. And that's what we're trying to fix. And we went to Congress twice to testify on this. And some changes have been made, but not the most important ones. The most important changes need to be made with changing the reimbursement structure of the Affordable Care Act from a fee-for-service model, which is what it is right now, to an outcome-based reimbursement model, where the good providers get paid more and the bad providers get paid less, and the incentive is for recovery rather than relapse. And the other change we need is to clarify the Americans with Disabilities Act, to allow local and state governments to enact reasonable guidelines to protect the residents of sober homes. Right now, the very act, the Americans with Disabilities Act, that is designed to protect people in recovery, is being used to shield those who would do them harm, to prevent reasonable oversight of these sober homes. And so now you have the flop house, ironically, being protected by the Americans with Disabilities Act because local governments aren't able to exercise proper oversight over these homes in their midst. You have drug treatment centers, which are licensed and regulated by the state, and then you have sober homes, which are not. And the theory behind sober living homes is that they are a group home for people in recovery where they can live in a drug-free, mutually supportive environment. But the problem is that there are some rogue sober home owners who send their residents to outpatient treatment centers, labs, and places where they get a kickback. And the money flows all around, and everyone is making money and getting kickbacks until the patient dies. And you have a willing victim in these cases, because when the resident is told, hey, I'll let you live here for free, you just got to do drugs every now and then. I mean, it's like a win-win for these people until they end up in a body bag or an ambulance. Kenny Chapman was the Pablo Escobar of the sober home industry, the worst of the worst. He's serving 27.5 years now in federal prison. Kenny Chapman owned sober homes and drug treatment centers, and if you wanted to live in his sober homes, you could live there for free if you were a woman, as long as you had sex with strangers for money. If you tried to leave, the doors and the windows were sealed shut, and he had your ID and your keys and anything else you needed to survive in the outside world. And those who didn't have sex with strangers for money to live for free had to steal purses from Worth Avenue, which is the Rodeo Drive here in Palm Beach. And if you were able to bring back enough, you could live there for free, but that was the only way you'd live in his homes. It was an example how the abuses in the drug treatment world feed into human trafficking, because that's what they were doing. A possible solution to this crisis is medically assisted treatment. You've got drugs to fight drug abuse. You've got Suboxone and naltrexone and Vivitrol, all these methadone, all these products out there that can really help. But when it comes to insurance reimbursement, the same type of people who will keep you in an endless state of relapse are now opening up clinics for Suboxone, And instead of medically assisted treatment, it's just medical treatment. You just are given drugs and told to go home and take them. It's replacing one opioid with another. You really need to have both. You need to have, in my opinion, the drugs, but with the medical assistance of a doctor. You need to be under the care of a doctor. Sending you home with hundreds of pills isn't going to get you well. And so this whole area is totally unregulated. Until we have better regulation, it's going to be this decentralized mess of all these different strategies and help centers where there's not one coordinated standard of care. Instead, you have everyone moving in different directions. It's decentralized, it's deregulated, and it's leading to, unfortunately, too many premature deaths. Now, for the good providers, and there are a lot of good providers out there, they're not keeping people in an endless state of recovery for money, but the bad providers are. The bad providers see this as a gold mine. The more times you relapse, the more money they make. And since there's no limit on how many times you can relapse under the Affordable Care Act, there is an incentive for the bad providers, the corrupted ones, to make you test dirty to get back in this vicious cycle again and again until you die. Because people don't know which are the good ones and the bad ones. It's such a deregulated industry. There's no one master list that says who's good and who's bad. And so if you're going on Google or Facebook and getting your healthcare decisions from there, you're going to be led astray. You're going to go to the person who's going to pay you to travel to their incredible, beautiful, immaculate sober home and drug treatment center that are none of the above. I'd like to see the Americans with Disabilities Act clarified by Congress to allow local and state governments to enact reasonable guidelines for the health, safety, and welfare of residents of sober homes. Let's go after the well-intended laws that have been exploited by bad actors to take advantage of people in recovery. Let's change that. Let's find out how to do so, and let's change it. I got so frustrated that I started my own website, fixthefloridashuffle.com, at my own expense, to tell the world what needs to be done. There are good players in the industry. We could have not cleaned up the industry here in Palm Beach County without the help of the good guys. You can't arrest your way out of an opioid epidemic. You need to have treatment, you need to have prevention, you need to have proper rehabilitation, because otherwise our jails are not sufficient to end this crisis on our own. And so, as much as I've been critical of the rogue players in the industry, I want to praise the good guys in the industry who were part of our task force and still are, who have cleaned it up. There's some people who are just paying it forward. There are people in recovery themselves who just want to do the right thing. But unfortunately, there are bad actors who have tarnished the entire industry. So now you have people who are unwitting victims who come down here taking a free plane ticket, not knowing that it's illegal, it's a felony, and then get shuffled around. And you have others who are afraid to come down here because they're afraid of bad rehab, not knowing there are a lot of good ones. So you have people who get into the Florida Shuffle and get into an endless cycle of relapse instead of recovery, and others who are afraid to seek help because they think the industry are a bunch of charlatans. Neither is true. The industry has good players, but you got to protect yourself against the bad ones. A 19-year-old girl named Brandy Mashad out of Sarasota. She came from a very well-to-do family, and she died of an oxycodone overdose, and this was around 2010, 2011. Our state had its head in the sand up to that point on what to do about this opioid epidemic. They refused to even enact a prescription drug monitoring database. But when her family endured this tragedy, they went to the legislature and they went to the governor. And the difference was that they were very well connected politically. They were very active in the Republican Party, and they were very close to the state's Republican governor. And they demanded to know why the state was doing nothing, was asleep at the wheel. And her death spurred the prescription drug monitoring database's passage after a decade of ignoring it, spurred new laws and new regulations that helped us clean up the pill mill and pain clinic industry, where you don't see pill mills anymore on our streets. And it happened almost overnight. But it took the death of a 19-year-old to wake up the legislators who thought this didn't affect them. So you could say her death was not in vain because it probably saved the lives of thousands of others. And so we try to root out human trafficking amongst us. The biggest challenge is that you have victims who are too afraid to speak up. And so you hope that by word of mouth we can encourage people to speak up. We have a lot of resources available to them that they do not know about. Even a national visa called a T visa that would allow people to stay in this country if they are a victim of human trafficking. So for people who are from elsewhere, and most of the human trafficking victims are actually homegrown, but for those who are really afraid of the police because they come from countries where the police are not their friends, they can stay in this country if they would speak up. But we have to get by this mistrust. We have to get the word out that silence is the enemy. And the law is here to try to help. My focus in this issue, to put it in a nutshell, has been I started investigating Purdue Pharma and OxyContin, and then shutting down the pill mills, which were huge factories of OxyContin and oxycodone. Then went after the corruption of the drug treatment and sober home industries as state attorney. Right now, Florida has gone from being the worst state with the most lax laws when it came to patient brokering and marketing abuses within the drug treatment industry to being the toughest state when it comes to patient brokering and insurance fraud and abuses in the sober home and drug treatment industry. We have cleaned up in Palm Beach County much of the abuse that has occurred within the drug treatment industry. Some of the problem is spread to other counties in Florida, but usually it's gone out of state to other places where the laws are weaker, where they don't have the enforcement that we have. We have largely eliminated the Florida shuffle in Palm Beach County, but we recognize that some of it has gone elsewhere. Before, it would take about 56 counts of patient brokering to score someone prison time. Now you get prison much easier. You get to hold accountable those who would broker patients from one sober home to another, manipulating the insurance laws to try to siphon every insurance dollar from someone who is sick with a brain disease of substance use disorder. We're properly holding them accountable because these people are truly despicable because they're taking advantage of those at the lowest stages of their lives, people with substance use disorder. And not only are our laws tough, but we have better oversight of our drug treatment industry. We're trying to help people in recovery. We're trying to protect them from being exploited by bad sober home owners who are chasing the almighty dollar.